have a little look in the Wikipedia. What is Strat? I was searching for Strat, the name. Strat is a large valley, typically a river valley that is wide and shallow. The opposite is a glen, which is typically narrower and deeper, so we have a lot of space with Strat. And the lexification of the Greek word Strat it is one of many that have been absorbed into common use in the English language. Did you know it?
No. The valley, yes.
Yeah. The study design accounted for the WHO study already and left it to the decision of the envisioned 50 probes. If at the beginning of the second cycle of oncologic system therapy they wanted to take part in the study, and if yes, if they wanted to regularly take the elixir consisting of yeasts which was biologically fed with herbs and plasmolysed, the alternative was to fill in the questionnaire without taking the Strat. Both groups, with and without Strat, filled in 5 questionnaires about their well-being during the cancer treatment. Recruitment took place at our Oncozentrum in Zurich, and the interest in the study was overwhelming. Even to the extent that very soon there was a dilemma, because only a teeny minority chooses to blame the taking of Strat. Well-known names. I'm sure that you cannot wait to hear the results. Inclusion criteria. The prognostic survival has to be more than 4 months, age between 18 and 80 years. Karnofsky index, meaning the well-being state, has to be a proper good one. And more than 75% of the oncological treatment has to be done during this study. Normally, we use that, the informed consent. The patient has to be informed and to sign all these study protocols. This is the first, the study design was made out for 50 and more patients, but with this dilemma we had to do with 7 pairs because very spare number of patients didn't want to take Strat. So we have had a self-assigned individual case control study of 7 patients compared with without Strat using. 5 visits in 16 weeks, and the evaluation was done by European Organization for Research and Treatment of Cancer, EORTC questionnaire, which is very well known and looks like that. EORTC. Perhaps the questions about were you limited doing something last week, or you felt nauseous, or do you have trouble doing your house duties? The second part of this questionnaire with the ending questions about how would you rate your overall health during the past week. functioning? A little bit?
I would say it was.
Thank you. Your R&D questionnaire. The questionnaire contains 30 questions pertaining to the fields global quality of life, physical functions, role functions, emotion function, cognitive functions, and social functions. Besides the functional scales, there are symptom scales, questions asking for distress signs and severity signs like nausea, vomiting, pain, tiredness, difficulty to breathe, sleep problems, loss of appetite, and so on. Very important symptoms in our field of oncology. The total quality of life curves, the abscissa shows the time axis over this 16. Divided into 5 visits. On the ordinate you find the score in person. The green curve shows the course of the well-being in the patient. The straight line stands for the slope. The slope is statistically very handy because in a single digit, perhaps minus 3.19, it represents the whole ups and downs of the curve. It is the same principle that prognosticates the performance of shares at the stock exchange. On this slide, we have a summary of all slopes of the 7 pairs. In gray, you find the partner with the better value within the pair. 0 at the end of the initials means no strat. As you can see, the quality of life results in a rate of 5:1 in favor of. We have the quality of life comparison. Here you see a graph with the results of the table 1 showed you before. High values are good, column. High values are good, low, even negative values are poor. Are given pairwise. Only in the second pair, here, the partner without strat performs better. For us, this looks very convincing. Huh? The most patients have better results with strat. We have a function scale diagram. In this, there is a summary of all functional scales for the 7 pairs. Each column represents the net value of the slopes within the pair. The columns above, no, it's not that big. Back. Sorry about it, yeah. We have the function scale. As I told you, RTC questionnaire is divided into function scales and symptom scales. This diagram shows the development of the different function scales over the 5 visits